Good afternoon, all. My name is Deborah Akinsilo. I am an alum of the Occupational and Environmental Medicine Residency Program at Icahn School of Medicine at Mount Sinai. And my pilot project is titled Transgenerational Effect of Endocrine-Disrupting Chemicals on Adverse Birth Outcomes. Let's jump right in. The goal of this project was to see if it is possible to determine multi-generational effects of occupational exposure through the construction of an intergenerational model of vulnerability. Figure 1 is a visual example of this model, in which we hoped to be able to find an association between a grandchild's birth weight and their grandmother's occupational exposure to endocrine-disrupting chemicals. We utilized data from the National Longitudinal Survey of Youth and the children of the National Survey of Youth that was initiated and maintained by the Bureau of Labor Statistics. We also used the endocrine disruptor job exposure matrix that was developed by a European consortium of occupational studies to analyze effects of maternal exposure to endocrine disrupting chemicals on intergenerational birth outcomes. And our primary outcome of interest in this pilot project was birth weight of the grandchild. The National Longitudinal Survey of Youth is a long-running biennial survey using a national sample of 12,686 subjects, of which 6,283 were women, who were between the ages of 14 to 22 years of age when the survey first initiated in 1979. They will henceforth be known as NLSY 79. In 1986, the children of the National Longitudinal Survey of Youth, henceforth known as NLSY Child, were a separate survey of all children born to the NLSY 79 female respondents. Subjects' work was categorized by 3-digit occupational and industry census codes, which allows for examination of specific data on subjects by occupation. The job exposure matrix was used to classify participants within comparative levels of exposure to endocrine disrupting materials. These groups were either non-exposed, possibly exposed, and likely exposed. For the first or initial generation, G0, we had 3,570 births to 1,770 mothers. Maternal job in the year of the child's birth was identified in 36% or 1,300 of those cases. Of those where jobs were identified, 938 worked in a job considered non-exposed to EDCs, 185 were in a possibly exposed job, and 177 in a likely exposed job. Turning to the child of the NLSY, Generation 1, for 14 years of data, we have job information on moms in the year of their child's birth for only 151 of the 3,608 births recorded. Due to the small number of subjects in this cohort, the likely and possibly exposed were aggregated in an overall exposed group. Let's turn to birth outcomes in the children. We looked at birth weight of term deliveries, so these are deliveries between 37 and 42 weeks. As exposure increased from unemployed to likely exposed to EDCs in their work, baby birth weight also increased, which we didn't think would happen. We get the same results when we adjust for maternal age, smoking, maternal body weight at conception, and month prenatal care started, though the differences become less and the p-value is smaller because of fewer subjects. The same pattern of heavier term birth weight babies is shown in the second generation, our babies of interest, but since there is less complete data to work with, the statistics are less helpful, though not insignificant. This was adjusted for smoking, alcohol use, and month prenatal care was started. So while these findings are unexpected, it could imply that the endocrine disrupting chemicals are contributing to something that would give you larger babies, like gestational diabetes, rather than retarding intrauterine growth. Overall, there were only 114 children for whom there was job information on both the grandmother and the mother. And we pulled together a path analysis on the effect of an exposed job through the generations. We found an effect of an increase of 15.7 grams with a p-value of 0.40, though the sample size was very, very small, in the second generation associated with the grandmother's exposure to an EDC exposed job. This was adjusted for smoking, maternal weight at pregnancy start, alcohol use, and month prenatal care started. It's hard to say if there is a real effect intergenerationally on birth weight. If it is very small and may not be of significance. Contrast that to an effect of smoking on these same 114 in one generation of a decrease of 167 grams, which is in the right direction and roughly the quote-unquote right magnitude. What is really interesting is that in each generation there is an increase in birth weight associated with the work in an exposed job. Data on endocrine disrupting chemicals exposure and birth outcomes is conflicting, and we did not look at preterm birth. The NLSY data didn't lend itself well to determining preterm birth. There are suggestions that EDCs may be associated with gestational diabetes, which might yield the increased birth weight we see, but the survey doesn't collect medical information for pregnancy, though, again, gestational diabetes is plausible. So what are some of the problems and limitations that we encountered here? While the NLSY data sets are large, various information is missing, which drastically reduced our sample sizes. It's a retrospective biannual interview survey, and so a lot of the data could be suspect to given issues such as recall bias. It does not ascertain if subjects were working and what type of job they were working at during pregnancy. Job at pregnancy could have been imputed from a prior year, but we did not want to do this initially. The infrequent interviewing and sampling of the children of the NLSY means there's much less occupational data than we thought there would be, which shrunk our numbers again significantly. There was a lack of information on covariates that might affect health, like say, did someone have insurance coverage? The EDCs were lumped together due to the small number. And so each type will have specific effects, and these can be in either direction. So there is an exposure misclassification. The job exposure matrices only provide average estimates of exposure for each job. So the exposure can be wide, especially in pregnancy, when a woman may very consciously reduce her exposures. And then there's a lot of unaccounted for factors associated with particular jobs. In general, we see that higher socioeconomic status jobs where you might see better birth weight outcomes were not exposed. So where do we go from here? As with many things in occupational environmental medicine, this pilot highlights the dearth of information in the U.S. on occupational exposures throughout the lifespan. And so we may as well shoot for the stars and hope that we land amongst the clouds and call for the establishment of a more robust cohort study that can pull from, say, health records, employment information from credit reports or the IRS, etc., and then to develop something that may mirror the birth cohorts of our European counterparts. Right. Thank you for listening. I'd like to firstly acknowledge my residency program, my attendings, and staff. Thank you all so much. You were the best. I'd like to thank the ERC for accepting my study proposal, and of course, NYNJERC for paying the bill. Any questions or comments or concerns? I am here to take. Thank you all.
All right. Thank you, Deborah. Deborah is here to answer any questions or was any discussions, feedback. I don't see any questions to type in Q&A session. So is there any comments or questions that you would like to ask Deborah? Please unmute yourself. I see Carol unmuted, but we can't seem to hear you. Right. If there is no question, Deborah, would you like to, do you have any questions to the audience or any last comments?
Afternoon, everyone. I just thank you all for attending and your patience with my video. I don't necessarily know if I have any questions. I did want to clarify there were some things I didn't explicitly say that they were included on the slide that we used generalized estimating equations to analyze the mean birth weight. So associated with the exposures, and this was to account for multiple pregnancies and births in the same mother within each birth cohort, so multiple births. And then the path analysis, so that's where we essentially found the linkage of B0 between the grandmothers and the grandchildren. That was done in M+. That's it though. Unless there are any questions.